Hello, my name is Bianca Hughes, and I'm an associate professional counselor at the Jordan Stones Counseling Center in Roswell, Georgia. I am under the direction of Mandi Peek and the supervision of Mandi Peek and Dr. Keny Felix. I primarily work with women struggling with perfectionism, helping them embrace their imperfections and authentically be themselves. So today I wanted to talk about goals in therapy. On Instagram, I have what I call therapy truths, where I share therapy truths about the counseling or therapy, whichever you prefer to use, what to expect, what is expected of you, what is expected of the therapist, and just things that maybe some people haven't shared or are unaware of when it comes to therapy. So one of the things therapy truth I wanted to talk to about today is goal setting. So we're in the new year, 2018, and some people are goal setting, some people are thinking about going to therapy or going back to therapy or other New Year's resolutions. So with anything that you're trying to do or trying to obtain, it always helps to make goals. Just know that your goals are always adjustable, and that goes the same for when it comes to therapy. When you come in, they'll be expected to have some goals in mind for your therapist, something that you personally want to work on. And just know that you will work collaboratively with your therapist on these goals. So your therapist will not be giving you goals and then you just go and work on them. No, you have a major say in this because it is your life. And quite frankly, we as therapists don't know yourselves better than you do. You know the best. But we do work collaboratively, of course, because we do have the expertise, and we have the expertise in regards to how to get there or help you get there with that goal. So here are some questions for you to think about. And of course, goals are going to be ongoing throughout the whole therapy process. So you'll set some goals, some things will come up, so you might rearrange the goals or have a new set of goals, or you might think, oh, okay, I came in because I wanted to work on my purpose and what am I meant to do here in life. But then you might realize, wow, I don't even know who I am. So now you're probably going to move and shift and go into identity work and then come back to work into on things in regards to purpose. And then even in identity, you're looking at your thoughts and your feelings, family, how they impact you in the environment. So there's a whole different things that go into working onto your goal and helping you get there. So just as I mentioned, here are some goals that some questions, shall I say, you can start thinking about in relation to your goals. So one of them is, what are you hoping for by coming to therapy? So a good way to think about that is, how would you like to leave therapy after this is ended? How would you like your life to have changed after you leave therapy? What do you want to leave behind? What do you want to add? So just some different things for you to think about. Another question is, what are personal goals you want to work on? So I say the word personal because if you come in and saying, I want to change my mom or my dad or my husband or my wife or someone like that, they're not in the therapy room. So it's pretty hard for us as therapists to work on them. We can only really work on you in that aspect. As much as you might want them to change and they may need to change, we can't actually do that. So personal goals for you is what you want to be thinking about when that question comes up. How can your therapist work for you to make your life better? Not how can your therapist perhaps give you ways to change your family members. Another question is, especially if you've been to therapy before, is what has worked in the past or what didn't work for you when you went to therapy. So that's another thing that you want to also think about as well, just for those who are actually returning or who have been. Really want you to be honest as possible. And in this, of course, your therapist will ask you more questions to get a bit more to the nitty-gritty of everything. But those are some things for you to also think about. You might also share how long you want to be in therapy, or some people shall say, which you can always share, but we can never really give an answer to that because everyone looks different, and it always depends on how much you are going to work yourself when you are outside of the room. So question you might ask your therapist is, okay, we're setting all these goals. How long will it take for us to actually complete that? There is no answer for that. You know, we could give you a couple of things and you could be done in 10 sessions, but is that really having you where you want to be? If we go back to the first question in regards to what are you hoping to get out of therapy, so it's always going to go back to being a bit patient, which is important to remember when setting these goals, that it's not doesn't always go like this. Sometimes it goes a bit like this, and around the houses when you are trying to obtain these goals, it's not black and white, it's not A, B, C, D, E, F. So I just want you to think about that. They're going to always be adjustable, and as you delve deeper into things, other things come up. So that's why I always make the big emphasis that goals are adjustable. So those are some things that I want you guys just to think about when it comes to therapy. Just making sure that you have your goals prepared, that they are your personal goals, that you know if you have been to therapy before, what works for you or what didn't work for you in therapy. And also that you have the mindset that it is collaborative work between you and your therapist, and that the goals will be adjustable. So thank you so much for your time, and I hope this was helpful.